All right, thanks everybody for joining. Like I said, this is the Intermacs and PDMacs user group webinar for February 26th, 2025. Thank you everybody for joining. I'm just going to go through the welcomes, introductions, and a few updates, but the majority of this call will be focused on the data manager survey. We do this survey once a year, and we will have some time at the end of the call for Q&A, open discussion, but the majority will be the data manager survey. So today on the line from STS, we have Nancy Honeycutt, Leanne Jones, and Emily Conrad. And then from Kirklin Solutions, we have Brandon Singletary, John Pennington, and Maceo Clegé. So thank you everybody for joining. Just a reminder, there are some networking opportunities if you're looking to get a little bit more involved in Intermacs. We do have a STS Data Managers Facebook group. There is a QR code if you'd like to join us over there. We have around 400 members, so that's great. We'd love to see you on that page, and that is for all the STS databases, not just Intermacs. Great networking tool. And then we do also have the STS Data Manager Collaborative, which was formerly known as the Mentorship Program. This is the program that pairs, if you're new to Intermacs or PDMacs, it will pair you with a more seasoned abstractor, someone that, has a few years of experience that can help guide you as you're learning the STS, Intermacs, PDMacs databases. So there's also a QR code that will take you to the sign-up form if that's something you're interested in. And also you can email Nancy Honeycutt or myself if you are interested in being a mentor. So thank you all for that. Just a couple of date reminders. The next report that will go out will be the end of March, and that will be the Q4 2024 report. And also the end of March 31st is the next data entry deadline date is April 30th for Q1. So we still have some time left for that. So just note your reports will be coming out for Q4 the end of next month. And then just a reminder, our next webinars will be March 26th at 1 p.m. Central. That will be a user group webinar, so similar to this call. And then we have a quality assurance report overview quarterly webinar, and that will be April 17th at 2 p.m. Central. AQO has been announced for 2025. For Intermacs and PDMacs, AQO is going to be a virtual event this year, so save the date. It's going to be September 23rd, and it will be a live virtual event. So if you do join us at AQO, there will be the panelists, the speakers, there'll be opportunity for questions and answers. And then there will also be, as in previous years, the on-demand content. So it will be a live event with live presentations, with the speakers, with the panelists, and then the on-demand content as well that you can watch after the conference. So save the date for that. That'll be coming up in September. And then I'm not sure if you joined our call last month, but Nancy introduced us to the idea of introducing a quality webinar for Intermacs and PDMacs. So we want to hear from you, what kind of quality improvement projects you've done at your site, how have you used your Intermacs data, whether it was from your reports, from the dashboard, how have you used it to drive quality improvement at your site. We would love to hear from you. Anybody that's interested in speaking, we would love to hear from you. So email Nancy or myself if you would like to share. So this will be the questions for the 2025 Data Manager Survey for Intermacs and PDMacs. This is done once a year, and all of this information will be published once we collect all the data. And in the past, sites have used it to help, add abstractors if needed and kind of look at the timing and how other sites are doing things as well. So get your polling fingers ready because there are about 39 questions. So, here is our first question. What is your background? Are you an advanced practice nurse, health information management, medical records, IT non-medical, quality improvement non-medical, perfusionist, registered nurse, other clinical? So like those folks that work in the cath lab, or a physician. So go ahead and answer that. And I did want to say, if you abstract for many different sites, maybe choose one of the sites, potentially the largest one, and then just answer all the questions in today's survey geared towards that one site. Okay, so it looks like all of our results are in. It looks like the majority, about 78%, are registered nurses, and then other clinical, 11%, quality improvement non-medical, 7%, IT non-medical, 4%. Great. And then do I need to share the results, Nancy, or can you see them?
Are they showing?
Yes. Do I need to show this though for everybody to see?
No, I could see it.
You can see it?
Yep.
Yeah.
If I take it away, can you still see it, Emily?
Yeah, it's everybody is individual with the polls. So if you press
Okay.
close, it's just yourself.
Okay,
Yep.
got it. Okay, all right. And then our next question is, who do you abstract for? First answer is a data abstraction company, a hospital, or I abstract for both. Okay, looks like the results are just about in. It looks like the majority of participants abstract for a hospital at 87%, 9% for a third-party data abstraction company, and then just about 4% do both. That's great. And then the next question is, how long have you been abstracting? Less than a year, 1 to 2 years, 3 to 5 years, 6 to 9 years, or over 10 years? Okay. All right, looks like we've got lots of great experience here with 24%, 10 years or more, 28%, 6 to 9 years, 20%, 3 to 5, 9%, 1 to 2, and then 19% less than 1 year. So lots of great experience, and as well, some new people to Intermacs and PDMacs. And then our next question is, what was your previous experience?
It's not showing up.
No.
Hold on. Here we go. Sorry about that.
Nope, you're good. Okay, so what was your previous experience? First answer option is clinical cardiac surgery, so cardiovascular surgery, OR, CV, ICU, perfusion. Clinical non-cardiac surgery, so cardiology, non-cardiology, med-surg, non-clinical and not in healthcare, or non-clinical but within healthcare. That looks like just about everybody. So the majority are clinical, so cardiac surgery or some other specialty that's non-cardiac surgery. 18% non-clinical, but within healthcare, and then just 2% non-clinical and not in healthcare. And then this is about what are your work responsibilities, duties? That's our next question. What are your work responsibilities? This question, I believe, is a select all that apply. Is that correct, Nancy? So,
Single choice.
it's a single choice? Okay. What are your work responsibilities? STS, Intermacs, PDMacs only, STS database, and other clinical responsibilities. So maybe still working on a floor, STS and other cardiology databases, something like NCDR, STS database, and other non-clinical responsibilities, STS database, and other surgical databases. And I do not abstract data. I'll give you a second on that.
That's a lot to read through.
And it's very specific.
Yeah.
All right, well, it looks like just about everybody that's going to respond has responded, with the majority of the data managers at 35% STS and other cardiology databases, followed by 26% STS database and other surgical databases. STS, Intermacs, PDMacs only was about 19% of us. And then no one is abstracting STS database and other clinical responsibilities. And then 4%, I do not abstract data. Okay, then our next question. Which database do you abstract for?
And we move on from that one. I don't have a poll for that.
Okay, sure.
Yeah, so just go to
move
the
on.
next one.
What is your assigned participant role in the STS national database? So are you the site administrator, a backup coordinator, or are you the physician representative for your center? Okay, so 53% are site administrators, 47% a backup coordinator, so just about a split. And then we don't have any physician representatives on the line today. Okay. And then our next question is, how many people abstract at your hospital? Answers are 1, 2, 3, 4, or 5, greater than 5. And if you have any questions while we're that pertain to the data manager survey survey, you can put the questions in the Q&A box. Okay, so 26% just one person, 33% 2 people, 5% 3 people, 2% 4, and 35% have 5 or more. How many cases do you abstract per month? For cases, we're going to call those new implants, not necessarily follow-ups, new implants. So going through a pre-implant, implant, and I'm sorry, demographics, pre-implant, implant, and an implant discharge. Yes, Heather, just for Intermacs. So how many cases for Intermacs do you enter per month? What do you think, Nancy? So Tasha's saying, what if you do around like 12 to 15? Should you enter the 5 to 10?
Yeah, I would put that in 5 to 10.
Okay. Okay. So around 55, Sheila, new implants. How many new implants
Oops.
do you do per month? For the question on how many people abstract at your location, were you asking only about Intermacs? And is the question about how many full-time FTEs or people? How many people are abstracting? How many people are abstracting? And yes, for Intermacs.
Patricia, should we rerun this question 9? I
Yeah,
think
we
I
can.
stopped it too early.
Okay, sure.
We'll relaunch that one. If everyone wouldn't mind answering this question again.
Okay, so it looks like it's kind of, the results have kind of stopped coming in. So 64% enter less than 5 cases per month, 30% 5 to 10 cases, 2% 30 to 40 implants, 2% 40 to 50, and then 2% 100 to 200. That's okay, Bonnie. It's okay. Okay. And then I believe there is later on in the survey, there is a question regarding how many follow-ups. So this was how many implants. Okay. And then our next, how many hours does it take you to abstract a case? Less than an hour, 1 to 2, 2 to 3, 3 to 4, greater than 4 hours. And this is really useful information when talking about FTEs and how many people are needed to abstract. This is for implants, yes. Okay, that looks like all the results are in. 13% less than an hour, 40% 1 to 2 hours, 18% 2 to 3 hours, 27% 3 to 4 hours, and then 2% at greater than 4 hours. That's good to know. Sometimes when new centers sign on, they ask, about how long does it take to do a case. And I usually say about an hour and a half to 2 hours for a new implant and about 30 to 45 minutes for a follow-up. So these numbers seem pretty much in line with that. Okay. Next question, what is your timing of abstraction for a case? Real time within 1 week of OR date, 1 to 4 weeks after OR date, greater than 4 weeks after OR date. We've got a split here with 17% are entering new implants in real time, 32% within 1 week of the OR date, 43% 1 to 4 weeks after OR date, and 9% greater than 4 weeks after OR date. And our next question, how many cases per year does your hospital perform? 0 to 50, 51 to 100, 101 to 200, 201 to 500, 501 to 1,000 or greater than 1,000. Yeah, Tasha, answer it for new implants, which this is essentially the same question we had a couple questions ago. Yes, Bonnie Vads, new implants. All right, looks like our results are in. 72% are 0 to 50 per year. Actually, I think the previous one was per month and this is per year. New implants, 72% 0 to 50, 51 to 100 were 15%, 101 to 200 is 7, 201 to 201 to 500 is 4%, 501 to 1,000 2%, and nobody at greater than 1,000. Do you utilize a third-party abstraction company? Yes, no. I don't work at a hospital. All right, looks like the majority are not utilizing a third-party abstraction company and doing their data abstraction in-house. At 89%, 4% do use a data abstraction company, and 6% do not work in a hospital. Our next question, what source do you collect data from for abstraction? Paper, so scanned medical records. Do you abstract directly from the electronic health record, or I use a combination of both? All right, 55% abstract directly from the EHR, and 45% use the EHR as well as scanned medical records. Then our next question is, how do you abstract your data? Directly into the database or on a paper form and then submit it into the database? So this would be like downloading our data collection forms, printing them out, or collecting data on there and then directly entering it into the database. So 89% of 87% enter data directly into the database, 13% abstract the data onto paper and then enter it into the database. Is there a process in place for tracking patients post-operatively? Okay, looks like the results are in. 86% do have a process in place for tracking their patients post-operatively, and 14% do not. Next question. Does the surgeon fill out the operative section or provide information besides the op note? And then the answer choices are yes, they fill out both the operative section and some other type of form. Yes, they fill out some other type of form to help with data capture. Yes, they fill out the operative section. No, they do not fill out anything extra, only the op note. Okay, it looks like the majority are not. They're getting all their operative details directly from the op note. And then 7%, they do fill out the operative section. Again, 7% fill out some type of form to help with data capture. And then others, the other 7%, yes, they fill out both the operative section and some other type of form. Are your surgeons available to answer questions? Yes or no? We're waiting on that. We do have a couple of questions. Rosalind, someone on the Zoom answered they implant more than 200 VADs per year. I'm wondering how many VAD nurse coordinators they have on their VAD team. So if you were that center and you'd like to chime into the Q&A box, we'd love to hear from you. Sorry, Hannah, I missed that. I'm not sure which question that was. Bonnie, we don't supply any additional operative forms. There is a surgeon's worksheet on the with the Intermacs appendices that could be used, or it could just be a form that your site has created to help with data entry, and so that the surgeons and the surgical team are aware of what data variables we're collecting. So that's kind of what we were asking. Do you use another form? Not necessarily one issued by us, but maybe something that you use at your center. Great, 80% have surgeons available to answer questions, 20% do not. And then our next question. How frequently does your physician representative review the Intermacs PDMacs data quality report? Always, frequently, occasionally, never. Okay, good. It looks like that they are looking at it. So 39% always look at it, 39% frequently look at it, 23% occasionally, and nobody answered never. So that's great. Next question. How frequently are queries reports run using the live data downloads? Oh, always, frequently, occasionally, never. If you're new to Intermacs and PDMacs and you are not familiar with the live data downloads, the live data downloads are a really nice tool where you can download all of the data that has been entered at your site. It downloads it in a nice Excel spreadsheet for everything that has been entered. And we've had talks at AQO on utilizing live data downloads, form downloads. Sometimes we talk about it on these webinars. So if you're new, you'll hear more about it. It's a really great tool. 8% always run the queries, 35% frequently, 48% occasionally, and just 10% do not use the live data downloads. How often are corrections made to the participant data based on the Intermacs DQR? And the answer options are, again, always, frequently, occasionally, or never. Looks like almost everybody has answered. So the majority are, the answer was occasionally at 64%, 25% never make corrections, 6% frequently do, and 6% always make the corrections. Next question, has your site ever been audited by STS? Yes, no, or unknown. I'm not sure if we've ever been audited. Okay, 58% say yes. Yeah, Carol, for Intermacs. 58% have been audited, 33% are not sure, and 9% have never been audited. Okay. Do you perform internal audits on your Intermacs and PDMacs data? Yes, no, or I'm not sure if we do. Okay, looks like just over half, 58% do perform internal audits. 33% do not, and 9% are unsure. I do have some samples from different centers that have shared their IRR tools. So if somebody is looking to maybe start doing this at their center to do, monthly or quarterly audits of your data, I do have some different tools that I can share with you and send. So you can email me if you're interested in that. All right, our next question is, have you utilized your STS data for quality improvement projects? yes, no, or I'm not sure if we have. All right, so it looks like around 60%, 61% have used your STS Intermax data for quality improvement projects. 5% haven't, 34% unsure if they have. Of those 61%, if anybody would love to share any of their quality improvement projects, we'd really like to have you on a future webinar. Okay. And now we're gonna rate STS's communication over the last year with the answer options of excellent, pretty good, average, or could be improved. Great, okay. 40% say the communication has been excellent, 49% pretty good, 11% it's average. Okay. And then our next question is related to the webinars. Do you find the monthly webinars, quarterly report reviews helpful? Yes or no? It looks like just about everybody. So 96% do think they're helpful, 4% do not find them helpful. Okay, so this is related to STS education. So do you feel you have the resources to do your job correctly? Yes, the resources are good, or no, more training opportunities. Right, 74% think the resources are good to be able to effectively do your job. 26% think there should be more training opportunities. So that's good to know.
We are looking at doing some additional training webinars in the future.
How do you utilize the Intermacs training manual? So the user's guide. Review monthly, still have questions, review monthly, answers my questions, review prior to submitting an FAQ, or what is the Intermacs training manual? So I will tell you all that Nancy and I have been working kind of behind the scenes. It's a long process, but we are hoping to improve the Intermacs users guide and align it a little bit more with the other STS databases. Looks like we have kind of split responses here. Okay, so 30% review it monthly, still have questions, 26% review it monthly and has their questions answered, 37% do review it before they send in a FAQ, and 7% what is the Intermacs training manual? And then our next question is, do you participate in the Data Manager Collaborative? So this is what was formerly the mentorship program. Yes, participating as a mentee. Yes, participating as a mentor. Aware of the program, not participating, unaware of the program. What is the Data Manager Collaborative? All right. Looks like the majority are aware of the program but not participating. 33%, followed by 33% were not aware that we had a data manager collaborative. 14% participating as a mentee, and I'm sorry, that was 14% participating as a mentee and 4% as a mentor. Thanks for all that are participating. The Data Manager Collaborative, I spoke a little bit about it at the first part of the call. It's a mentorship program where you're paired up with a seasoned data manager to kind of be there as a good resource when you have questions and learning the database, and be a mentor for them. So on this slide deck, once it's published, you can go back, and there is a QR code that will scan a form if you are interested in participating. So just a little bit on that.
Yeah, you can also find information on the STS website. It's under resources for data managers.
How would you rate your overall experience with the Data Manager Collaborative? Very good, good, neutral, poor, or I don't participate? Okay. All right, so the majority, 70%, are not participating, but those that do have had 4% have had a very good experience, 13% a good experience, 9% neutral, 4% did have a poor experience with the Data Manager Collaborative. And our next question, are there any aspects of the program that could be improved? Again, speaking of the Data Manager Collaborative. So here, Nancy, they can type in a response, correct? It's a text box.
Oh, I'm not sure,
Yeah.
Emily.
Yeah.
Okay.
That's what, yep.
Thanks.
The staff who are doing the data collaborative project just ask for some additional feedback so that we can improve or, help everyone out.
It doesn't look like too many more responses are coming in. Do you want to leave it open a little longer, Nancy, or what do you think?
I just ended it by accident.
Okay, well then that's that. Hopefully
Sorry.
we got your feedback. All right, our next question is, we're almost done. I think there's just a few more questions. On average, how many hours per week do you commit to this program? So Intermacs, PDMacs, how much time per week do you spend on this database? 1 hour or less, 2 to 4 hours, 5 to 7 hours, more than 8 hours, or I don't participate. Looks like pretty much everybody's answered. So it looks like the majority spend over 8 hours on Intermacs. And then 19% 2 to 4 and 5 to 7. 12% of the participants don't participate in Intermacs, and 5% spend about an hour or less per week on Intermacs and PDMacs. Oh. Good question, Tasha.
I think that was related to the data manager
Oh, okay. Should
We
we
can,
relaunch it?
collaborative.
Yeah.
Can we relaunch it, Nancy? I'm sorry.
yeah, we can.
I'm sorry. Okay. Thank you, Tasha. Thank you, Heather. Yes, you're right. This is all still in the realm of the data manager collaborative. On how many hours a week do you commit to this program? Apologies, everybody. Well, I'm glad you guys all got the question right. I was reading it wrong. Sorry. Okay, so
Alright.
majority of the people responding, 70% don't participate in the data manager collaborative, but those that do, 14% say they spend about an hour or less a week. And then 12% about greater than 8 hours a week, and then 5% 5 to 7. Okay. All right, and then our next question is related to AQO. Did any staff attend the STS Advances in Quality and Outcomes Conference? Yes or no? Like a 50-50 split. About 48% yes. Somebody attended AQO, and 52% no. They did not. They have not attended AQO. If you're new here and you're not sure what AQO is and what we're talking about, AQO is our annual data managers meeting. This year it is going to be in September 23rd. It's going to be a virtual event. In the past, it's been in person or virtual, is kind of alternating. But this year it is going to be virtual. So there will be more information coming out on webinars in the next couple of months about how to sign up and, what our preliminary agendas are looking like, and more information to come. So if you're not familiar with AQO, that's what it is. Yes, it's virtual, so everybody can attend. So that will be great.
And Heather's asking about the cost. We don't have any information about the cost yet. So more to come on that.
Yeah, we'll probably have that posted in the spring.
Great. And our next question. If you attended AQO, did you find it useful? So any AQO in the past, not necessarily 2024, but any AQO, whether it was in person, virtual, did you find that it was helpful? Okay, so those that did attend, it looks like 100% found that it was useful. If you attended the AQO Hot Topics webinar, which is the follow-up webinar to each of the AQO conferences, we have had those maybe the past 2 or 3 years. Did you find those Hot Topics webinars to be useful? So if we have any questions or maybe a topic that comes up at AQO where there's, seems to be a lot of discussion, or if there is a topic that comes up at AQO where we need to, take it back to the surgeon leaders and, get their feedback, we take all that information from AQO and then we present it at the Hot Topics webinar. And anybody that attends AQO, whether you attended a virtual or a live in-person session, you are invited to the AQO Hot Topics webinar. So yeah, 100% thought that it was useful. Looks like we have a couple questions. Is it possible to know how many participated in the survey today? Mitzi, do we share? Or go ahead, Nancy.
I think we can probably share. It depends on the question. Between 50 and 60, depending on the question. So participated in the survey today.
Because I think there's
For the
more
past
than
few
that.
years, we've had the same presentation for right heart failure. Maybe send out that info via email or virtual platform for 2025. We do have on the STS website, Rosalind and anyone else who's interested, on the STS website is a submission form, and you can submit topics that you would like to see presented at AQO. So if there's something you want to hear about or learn more about, please submit that to us so that we can consider it when we're doing our planning.
Nancy, on that form, is there the option of indicating if you would potentially be interested in being a speaker, or is it just a topics suggestion form?
I think it's topic suggestions. Emily, do you want to
I can provide more.
elaborate?
Yeah, I can provide more information. So on the form, it has the submitter name, and you put in your contact information, and then you select the type of session that you would like to see. So for if you're looking at Intermacs and PDMacs database, you would click that one, but all of the different databases are listed there. And then you can suggest a topic and then the type of format that you would like to see. So is it would you like to see a panel discussion, or is it about surgical procedures, or do you want to see case scenarios? You fill in information about the description of the session that you would like to see. So, and then learning objectives. And the learning objectives is optional. And then and then we have a spot for speaker name. So if it's yourself that would like to present, you could put in there your own name, and there's an option to add additional speakers as well. And that form is due by April 18, and you can find it if you go to the website. You have to go to education calendar of events and then click on the AQO meeting, and that's how you get to the form.
I just put a link to it in the chat box.
Great.
As well.
Thanks, Nancy.
Copied from you, Emily.
Oh, no worries.
Thank you both. All right, next question. Does your institution budget for data managers to travel? Yes or no? Okay. 65% do not have money budgeted for travel, and 35% do. Next question. Which challenge do you face with in-person meetings the most? And the answer options are budget, affordability, date, length of the meeting, or location. Okay, budget and affordability represents 66%, location 22%, and date length of the meeting is impacts at 12%. Our next question. What areas can STS improve upon? Analysis report education, basics of the data warehouse platform, clinical education, communication, pre-analysis, data cleanup education, or technical support. Okay, looks like our results are in there. We can go to the next question. I think this is our last question. How much time do you spend on completing follow-ups per month?
Is that running? Oops, sorry. Operator error. There we go.
Okay. So less than 5 hours, 6 to 10 hours, 11 to 20 hours, 21 to 40 hours, or more than 41 hours a month working on follow-up. Okay. Looks like we're split here as well. 5% less than 5 hours, 23%, 6 to 10 hours, 26%, 11 to 20, 26%, 21 to 40, and 21% spend more than 41 hours a month on follow-up. So I think that concludes our data manager survey. I think that's the rest of that is all of our questions. Nancy, do we want to go back to the which registry do you, or which database do you abstract for, or that was the one I think it was missing answer options?
Yeah, it was, I'm missing that question. Here we go. Here we go. Got it. We'll go back to that.
Okay, so the answer options here are Intermacs, Intermacs and congenital, Intermacs and general thoracic, Intermacs and adult cardiac, Intermacs and PDmacs, adult cardiac, congenital and Intermacs, adult cardiac, general thoracic and Intermacs, and adult cardiac, congenital, general thoracic and Intermacs. So. Okay. Looks like the majority abstract only for Intermacs at 69%, 11% abstract for Intermacs and adult cardiac, 11% abstract Intermacs, both Intermacs and PDmacs, 9% adult cardiac, general thoracic and Intermacs. That looks like it.
I'm really glad that our employers aren't making everyone abstract for all 5.
Jim, how do you keep it all straight?
That
That's
would
a lot.
be a very difficult assignment.
Yes. All right. Well, thank you so much, everybody, for participating in this year's data manager survey. Those results will be published by STS, and you are free to use that this data how you'd like. Bill, I see your comments here regarding the Epic Community Library. Do you want me to take you off of mute and you can kind of just let everybody know what the status is with that? Does that work for you? Uh,
Okay, can you hear me?
I can. Hey, Bill, how are you?
Fine, you? Yeah, so yeah, I don't know how many were on the webinar when I presented the index report for follow-up forms for if you have Epic, you can pretty much just roll right down along everything that's in the follow-up form. Everything's there, except they still haven't built out the comorbidity section for me, but everything else is there from pretty much the start of the follow-up form. You just keep on flipping through and scrolling down through Epic. Your data analyst should be able to download that and hopefully get that implemented at your center if you use Epic. And I've been getting questions on it, so certainly feel free to, if anyone has any questions, to email me.
Thank you, Bill. And Bill did put in the Q&A box his contact information if you'd like to get in touch with him. Thank you so much.
Yep, no problem.
Yes, Sue Ellen, a lot of time is spent on readmissions, follow-ups, adverse events.
Oh yeah, I can do follow-ups in about just over 10 minutes now, typically.
That's really great because I usually say it takes like 30-ish minutes. So that's really great. All right, well, we're kind of at time here. Thank you so much, everybody, for joining. These slides will be posted on the STS website on the YouTube channel for Intermacs. So thank you all very much, and we will see you on next month's webinar. Appreciate you all joining and participating in the survey today.
Thanks, everyone.